Welcome to the Fix Your Sciatica podcast, where we meet with experts and clients and discuss how to manage your sciatica and low back pain without the use of medications or surgery. I'm your host, Dr. Ashley Mack, and I'm a physical therapist as well as the founder of ifixyoursciatica.com, a go-to resource for pain management.
If you're joining us for the first time, thank you for listening. And if you are tuning in again, welcome back. And lastly, if you find today's episode or any of these episodes of this podcast to be helpful or insightful, please follow and rate this podcast on whatever platform you're using. The more followers and ratings we get, the more we can help people like you. And without further ado, let's get started. When I first graduated from physical therapy school, I truly believed that I would be able to fix everyone experiencing pain. Literally, I would walk around thinking that I was the best physical therapist ever. And then reality hit me quickly. In the first clinic that I was working out, I was actually able to only help about 75% of the people that I saw. I was working in an insurance-based clinic where you're one of 3 or 4 patients that the physical therapist was managing during that specific hour. And why wasn't I able to get to that full 100%? Most cash-based physical therapists are probably going to say, well, Ashley, you were a slave to the insurance industry and you couldn't have possibly had the headspace to truly provide 100% one-on-one care at a time because you were truly, in fact, juggling 2 to 3 more patients during that hour. And the more seasoned physical therapist is just going to say, well, Ashley, you just can't fix everyone. And I don't know about you, but I love feeling in control. And I also hate not being in control. And the 2 statements that I just mentioned to you puts me in a position where I'm in no control of patient outcomes. And this fact or this realization truly upset me because when I decided to follow through with this profession, I was set on helping others, especially when it comes to managing pain. So over the years, I studied hard, opened up my own clinic, transitioned into moving to the digital space, and it brought me here to you guys, the listeners of this awesome podcast. I realized that physical therapists, chiropractors, doctors, anyone who works with people dealing with pain, they have to do everything in their power, ability, and skill to get results. Not stopping at anything, and perhaps even referring out to another professional if something doesn't add up. And today, I'm actually going to share you an instance where physical therapy and movement would not be helpful when it comes to treating back pain. From there, we're going to talk about what are called medical red flags. And then last but not least, provide a checklist to see if you would be a candidate for movement or some other therapy. So let's rewind back to 2019. A friend of mine actually asked me to help her husband who was having such intense and horrible back pain. And knowing my background, she knew that I could help. Got on the call with a patient of interest, and over the phone, I focused on one thing only: get as much information as possible. You know, it's easy to say, oh, you have back pain, so here are 15 stretches that are designed to help with that pain. However, if you're a frequent listener to this podcast, that is not how I operate. If you're new to this podcast, the overlying theme in every sciatica pain management plan is to ask questions and then figure out what makes the pain feel better, do more of it, and modify or eliminate the positions or movements that actually make the pain worse. So this is what I heard. The husband had an on and off back pain episodes in the past, which would just go away with time and rest. However, this most recent episode, the pain was way more intense and it was quite debilitating. I asked if there any specific incident that may have caused this pain, and the reality was he didn't really recall any specific event that brought on the pain itself. So then I walked him through the 2 days before the onset of symptoms. I said, okay, 48 hours before your pain, what happened? And as described, there was nothing out of the ordinary that he could identify that may have brought on his pain. So then I started asking a little bit more, taking a deeper dive into the symptoms, trying to figure out what he was experiencing. He brought up that he was also nauseous and was vomiting since the onset of pain. And this fact itself waved a big red flag in my mind because orthopedic issues do not present with nausea and vomiting unless the pain is so intense that it causes these symptoms.
I specifically asked, is this nausea and vomiting because of the pain, or do you think it's caused by something else? And he wasn't certain. All he knew was that he was really uncomfortable. So then I moved a little bit further along the interview and then asked a few more personal questions. He stated that actually since the onset of his pain, he was having trouble urinating and he wasn't really producing that much pee or urine to begin with, but his also back pain was relieved by slightly when he was emptying out his bladder. So we found something that provided some slight relief, which is emptying his bladder, but then the pain was also associated with urine production. So I asked him if he or his family had any issues or challenges when it came to kidney function or bladder function. And he said that actually his father had experienced kidney stones in the past multiple bouts. And if you're not familiar with kidney stones, it actually occurs where there's excessive buildup of minerals and acids in the kidneys that it actually truly forms a stone or a crystal, and it can actually cause unrelenting pain in the flank/low back area. And this buildup can be due to an inability to metabolize a specific nutrient or having too much of a mineral. As a physical therapist, we can help identify some possible red flags that require medical follow-up with a physician, but we are not in the position nor licensed to diagnose conditions like this. However, with my clinical decision-making, I actually concluded that he was not a candidate for physical therapy, and it was actually prudent for him to speak with a physician for medical follow-up. We ended the call right there. A few days have passed, and then on a follow-up call with my friend, just check in to see how things are going, it actually did indeed turn out that he had a kidney stone and was given medication to treat the issue, and then as a result, the pain went away. Now, here is a very specific case in which movement, stretches, massages, or exercise truly does not help with pain. And in the story, you may have heard me say a couple times, medical red flag. Now, what exactly is a medical red flag? It's a sign or a symptom or a combination of signs and symptoms that indicate a need for further medical follow-up with the physician. Someone licensed to evaluate other medical issues that would either require a medical intervention like medication or surgery. It is our responsibility as people and professionals who work with others via pain management to identify these red flags and ensure that no stone is left unturned. These are the 9 questions I'll have you or my patients ask themselves, or I ask my patients, and it helps us understand if there's a red flag that truly needs to be assessed. We start off with, since the onset of your symptoms, have you experienced, and these are the 9 questions. Complete loss of sensation or strength in your extremities. That's a pretty big deal because if you lose function of your extremities, that means that the nerves and muscles are extremely irritated or compromised. Number 2, any numbness in your pelvic region. We call this saddle anesthesia, and that is a very compromised area. Number 3 is changes in bowel or bladder function. This can indicate a whole bunch of other issues. And number 4, unexplained weight loss or gain, not to be confused with just not eating right and not exercising, but for some reason, weight is being added or subtracted without any sort of effort or any sort of reason. Fevers, sweats, or chills. Number 6, any nausea or vomiting. Number 7, night sweats. Number 8, pain that wakes you up at night. And then 9, general malaise or the feeling of being unwell. If my patients or people are answering yes to one or multiple of these questions, then it's advised to be evaluated by a physician before continuing treatment, because symptoms that are being experienced like this need medical attention. However, if you are in fact experiencing these symptoms, but you're also under the care of the physician and they are treating those, and you are cleared to complete exercise or stretches, then it might actually be safe to proceed as long as there is physician clearance to start a program. These safeguards are here to protect you, everyone, and maximize recovery time. And this information isn't supposed to scare you, but to make you aware that there can be other forces at work that can be contributing to pain. And the good news is the fact that you do not have to go through this alone, and the world is teeming with professionals like myself that are here to help you.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.